Affirming Autistic Adults. A Therapist's Guide to Neurodiversity, Competent Care and Effective Interventions. By Reinhart, Missy Wilson. And narrated by Madison G. The information contained in this book is for educational and informational purposes only, and is not intended as a substitute for professional psychological, psychiatric, or medical advice, diagnosis, or treatment. Always seek the advice of qualified mental health professionals or medical providers with any questions you may have regarding autism, mental health conditions, or treatment options. The therapeutic approaches, techniques, and case examples presented in this book are based on current research and clinical best practices, but should not be applied without proper training, supervision, and consideration of individual client needs and circumstances. The names and scenarios depicted in this book are purely for illustrative purposes only. Any resemblance to actual persons, living or dead, or actual events is purely coincidental. All case studies and examples are composite scenarios created for educational purposes and do not represent any specific individuals or actual therapeutic relationships. The inclusion of any therapeutic modality, assessment tool, or intervention strategy in this book does not constitute an endorsement by the author or publisher. Readers are encouraged to evaluate all information critically and consult with qualified professionals before implementing any therapeutic approaches. Chapter 1: Shifting the Paradigm, From Pathology to Neurodiversity. The therapeutic world stands at a crossroads. For decades, we have approached autism through a lens of deficiency, disorder, and dysfunction. This medical model, while well-intentioned, has created more harm than healing for countless autistic adults who have sought mental health support. The time has come for a fundamental shift in how we understand, assess, and support our autistic clients. The evolution from medical model to neurodiversity paradigm. The medical model emerged from a desire to help, but it began with a flawed premise. In the 1940s, when Leo Kanner first described autism, he viewed it through the same lens used for other psychiatric conditions, as something broken that needed fixing. This approach dominated autism research and clinical practice for over 7 decades, shaping how professionals were trained and how services were delivered. Consider Sarah, a 35-year-old software developer who sought therapy for anxiety. Her previous therapist spent months trying to teach her to make eye contact and engage in small talk, viewing these as essential.
Sample complete. Ready to continue?